And let's go off to KwaZulu-Natal, where the Public Servants Association is calling on the Premier Thami Ntuli to intervene in what they say is ongoing victimization and bullying of members at the Prince Mshiyeni Hospital. The union claims that nurses and other hospital staff are subjected to relentless abuse by the matrons as well as the labor relations personnel, leading to severe staff shortages and compromised service delivery. Joining us now is Mlungisi Ndlovu, who is the PSA's KZN manager, to talk about the serious allegations. Mlungisi, a very good morning to you. Thank you so much for making time for us. You speak about bullying. Can you expand a bit further on what exactly is happening at the Prince Mshiyeni Hospital?
Good morning to the viewers. Our concern as PSA in KwaZulu-Natal is that Prince Mshiyeni Hospital, in particular ICU staff, have been subjected to victimizations and bullying by the matron. And these matters have been escalated to the CEO, where some of the members have been giving leave without pay. They have been charged, and the managers are using discipline as a tactic of bullying them. So segregations, favoritisms, they are ill-treated, and some of them have resigned. And we have written letters to the HOD, to the labor relations, but they seem to ignore us. And it concerns us as a PSA because when we raise these issues, we try to ensure that we reduce litigations, because if we take them through the process, the department already are paying a lot of money. Our concern is that this matron, one of the shop stewards tell the CEO in the meeting that this matron has said there's nothing that they can do because they've got protection at higher level. And the concern is that when we wrote to the HOD, there are no response, labor relations, they are not responding. We have just asked a simple things. Appoint an investigator, because there are serious allegations. Remember that there is shortage of staff at Prince Mshiyeni Hospital, which result to long queue, and the public will think that these nurses don't want to work. So as PSA, we can't be silenced, because HR also is contributing, because HR take the side of the management. And when you go to the hospital, face a staff who's aggrieved, especially those that work at the ICU, you expect them to work diligently. They do their level best. That's why we are calling for the Premier of KwaZulu-Natal to intervene. By the way, it's not only Prince Mshiyeni. In Aldrin Sampear, our members are facing the same things. You go to Dr. Sayasemi. In hospitals in KwaZulu-Natal, we have seen the rise of these matters. But when PSA raise these issues, they seem to be ignoring us, because when we have written to them to say, let's be able to engage. Now, our members want to resign and go to other provinces, and the province will not be able to live without these nurses with critical skills.
Yeah. Again, when you say bullying, what do you mean? What form does that bullying come in?
Whenever our members are raising issues, the matron will charge them. When they are off sick and have visited the doctors, the managers will instruct HR to give leave without pay. Members will call them with different names. Our members have been reported to the nursing councils because they want our members to lose their certificate. There are different kinds of bullying, because other people, for example, who were working the same roster, they did not deduct the leave without pay, because certain people are being protected. And the matron does not talk to our members at all. How do you work with people that you cannot be able to engage? We are saying people that are working at ICU, it's a critical care. So they need to be able to respond. But we're very shocked when we appeal to the department to say, appoint the investigator so that you can be able to deal with these particular matters. And if you look at Prince Mshiyeni, for example, it's one of the neglected hospitals in the country. I've never seen such hospital in bad condition that still has asbestos. When we report to them to say it's affecting the health and safety of our members, there is no response. We are saying the Department of Health, the HOD and the MEC, when we raise these issues, they must not take it personal, because Our duty as PSA is to protect the interest of nurses, of doctors, of support staff. So the Prim of KwaZulu-Natal need to be able to visit that hospital and be able to implement a plan. That hospital, by the way, it services over 800,000 population. It's even bigger than Ugu district. So as PSA, we can't be silenced. We're going to follow all the dispute resolutions process to represent our members, but our fear is that the department is paying a lot of money because they are losing cases in arbitration, they are losing cases in labor court, and HR is not competent in the Department of Health, not all the institutions, to deal with these matters because they just implement. Even when we tell them to say, this law does not allow to do 1, 2, and 3. And as PSA in the province, we're dealing with a lot of cases of bullying. And the bullying in KwaZulu-Natal, not only Department of Health. Last week, I had a meeting at the state attorneys where our members are complaining about the same. We seem to have this lack of leadership with integrity, employee engagement, and morale of the employee is very low, and you need stronger public servants, and leaders must be able to understand. We respect that it is their prerogative to discipline, but if you cause destruction, and the very same matron has caused chaos wherever she goes, she causes problem, and the department, they've got tendencies when people are charged and there are allegations, they move them around, they don't resolve problem. If they are refusing to engage with us, let's put the challenge to the Prim of KwaZulu-Natal and see whether they will neglect PSA. We know PSA is not aligned to any political parties because we believe that we must fight bread and butter issues of our members. We are saying, our members are saying we are applying. We are prepared to go to Gauteng and other provinces, and the people of KwaZulu-Natal will suffer.
Yep.
Why
don't you take any legal action, though? Why don't you take any legal action against the department, against the hospital? You've written to the HOD saying that if by the 18th of July, these issues have not been resolved, we will escalate this.
So we have taken the process. You know, when you deal with legal processes, it takes time. So that's why we are saying we have issued a media statement. We're not going to leave them. We have dealt with the department before. We have won so many cases. So when we send them letters, we want them for us to have engagement. I can assure you that they will be able to pay. And we are also working with our legal teams in head office to ensure that those who make wrong decisions must be able to pay in their capacity, because when these managers make wrong decisions, bull our members, victimize our members, they know it is the budget of the department that will be able to pay. Now they must pay for their pocket so that they will be responsible for their decision. That's why we are saying we must be able to engage. If the HOD blue tick us, then the HOD, which means he's not competent, but he has been willing to engage with us, but his response is taking time. We don't wait until people commit suicide because they are frustrated. Some of them are seeing psychiatrists. So we are saying our members are under attack. As PSA, we cannot be silenced. We are saying we're raising these issues because it is our constitutional right to protect our members' interest. Okay. We're calling the public servant to say they must make sure that they educate their managers, because we want public service to service the citizen with a smile. So it is the responsibility that we say all the department, if they pull our members, will be able to take necessary actions.
Yeah, we have reached out to the hospital. They've referred us to the Department of Health, so hoping that the department will then respond to us. But from the PSA side, as it stands currently, there's no intention whatsoever to down tools or to go on a go slow.
So what we have said as PSA is that there's been a practice in that hospital where assistant nurses are forced to do the work of professional nurse. What we're going to do, we're going to report this matron to the nursing council, and we are calling the nursing council also to stop being biased, because in most cases they are dealing with the conduct of the nurses. They must now deal with the conduct.
Sure, but does sorry, Mlungisi, does that mean that you are not going to protest? You're not going to go on a go slow?
So what we're saying, we know that it's an essential service hospital, but what we're saying is that we're going to stick to the scope of work. If our members are giving work beyond, because there is shortage everywhere. I'm telling you, if you can visit that hospital, we also challenge the Minister of Health to visit Prince Mshiyeni and see the condition of that hospital. We are saying, we talk about big hospital, Inkosi Albert Luthuli, Dr. Priska Isasem, they must listen to us. We'll embark on an action and we'll be able to communicate to our members. But we'll continue to protect them. It is our responsibility without fear and favor. And the Minister of Health, they must also be involved because we must protect the nurses, we must protect support staff. No one is allowed to bull others. That's why I always encourage our members, when you service the public with smile.
Thank you so much for your time. That is Mlungisi Ndlovu, who is from the PSA in KwaZulu-Natal.